contraction in case of inhalation. So just keep in mind, in order to understand, keep in mind the balloon in your mind. Okay, so what happened to the balloon when we fill in air? It expands, its volume increase. So same happened with the lungs. When you inhale, the volume of the lungs increase. Okay, so how we inhale? So during the inhalation process, these diaphragm, because the lung has to increase in size, so definitely this should give some space to the lung. So what happened? These muscles, they move downwards. You have to memorize this. Okay, you have to not memorize, you have to actually understand this, because when they move down toward the abdomen. Okay, I can just remove these extra things, okay, so that you will not confuse. Okay, now what happened during the inhalation process? The diaphragm moves downward towards abdomen. Okay, so creating more space, giving the space to the lungs. And similarly, these ribs, we have ribs, this is called rib cage, and we cannot see here, maybe in the next slide I will show you. We have some muscles which are here outside the ribs. Okay, we have muscles which are attached to the ribs. So these muscles are called intercostal muscles. Okay, so what happened during the process of inhalation? The diaphragm contracts, the muscles of the diaphragm contracts, and they push the this dome shape diaphragm toward the abdomen, creating space. And also the muscles, the intercostal muscles also contracts, and they pushes the rib cage outside, toward outside. Okay, outside. So what happened? There is a more space. They are opening and creating more space inside the lungs. So when there is more space inside the lungs, so we know that what happened when there is a more space inside, the air pressure decreases. Why? Because when there is a more space, the pressure outside, the air pressure outside the atmosphere is increased, and the pressure inside the inside that organ is less. So air automatically, we know that it flows from the area of higher concentration to lower concentration. Okay, gases जो है, the gases always moves from higher to lower concentration. So the air is also a gas, so it moves with the movement of this intercostal muscles around the rib, which have moved the rib cage outwards, and then the diaphragm moves below toward the abdomen. It contracts and moves toward the abdomen, so it creates more space. Okay, so there is a more space, and the lungs become big, and they allow the air to flow into the lungs, and we inhale. Okay, so what happened in the case of exhalation? Understand what happened in the case of exhalation? So exhalation actually, it's the reverse of inhalation. So what happened during the inhalation? The rib cage was moving outward, and the muscles here contracts. Now the muscles of the intercostal muscles, if they just relax, and the diaphragm also relax to its final original position, they compress the lungs. So this compression actually easily can bring out the air from the lungs to the atmosphere. Okay, so but if we forcefully have to exhale, what happened? For those also we need muscles, right? So there are some muscles which are present inside our ribs. Okay, here they're present inside our ribs, and these are called internal intercostal muscles. Okay, so with the internal intercostal muscle, when they contract and the diaphragm relaxes to the original shape, they actually allow the rib cage to relax to its original position. So ribs came back in the process of exhalation. So they compress the lungs, so the air is forces out of the body. Okay, understand? I think I have explained. Okay, now we can move to the next slide. You can clearly see in that slide what's happening actually. Okay, right here you can see. And then no, don't worry, we will do a difference between inhalation and exhalation, and you can write that as well. Okay, I have made the points so that you can easily understand what's the difference between inhalation and exhalation. If you have to write in exam like the point wise, right now just focus on understanding the mechanism. Okay, if you just once understand it, you will never forget in your life. Okay, now what happened in inhalation? Air inhaled, inhalation actually contract and the diaphragm moves down. Okay, it's contracting down. The rib cage is moving outside and the rib muscles contract and moving the ribs outside, making the lungs, giving them more space and making the lungs big. Okay, they are just like a balloon. Okay, they are filling with the air and making it big. Okay, during the process of exhalation, what happened? The diaphragm just relaxes and moves to its original position, compressing the lungs. And similarly, the rib cage also relaxes to its original position when the muscles relax. Okay, and the air is forcing out of the body. Okay, understand? Okay, we have done this. Now I told you I have make a comparison for you so you can note down it. Okay, now what happened in the inhalation? What is the difference between inhalation and exhalation? Inhalation is the action of inhaling or breathing in air, while exhalation is the action of exhaling or breathing out air. Okay, number 2, the size of the chest cavity increases in inhalation, right? Because you have to fill in air, so it needs a space, so definitely it should be increase in size, right? So in order to take out the air, you have to be like, if you don't have the space inside your room, there's a less space, you have to kick out some people out of the room, right? so there is a less space, the air should go out, so the size of the chest cavity decreases and it pushes the air out from your body. The diaphragm contracts. This is a very important point to memorize or understand, that the diaphragm contracts in the process of inhalation. Sometimes you just sometimes confused. Kids get confused whether it relaxes or contracts. So it contracts and flattened. This shape is like this, right? So it flattens a little bit, so giving more space to the lung and moving downward. Contracts, flatten, moving downward in the inhalation, whereas in the exhalation the diaphragm relaxes and become dome shape like this. Okay, it's okay like this. Maybe I made a wrong like this, like dome. You know what the dome look like this. Okay, this is the relaxed shape of the diaphragm. Okay, this is the shape while contracting. Okay, and this is the dome shape. Okay, the lungs expand, the lung contracts. In this, the lung expand, muscle contract. Okay, remember this is the opposite thing. The lung contract while the muscle relax. Oxygen is taken into the blood while carbon dioxide is taken out from the blood. Rib cage moves forward and outward. Okay, outward, while the rib cage moves downward and inward. You can also experience this just by breathing air. Just imagine. Not imagine, just sit and breathe and just feel what's happening to the ribs and what's happening to your body. And then take out the air. Breathe in, breathe out. You can just understand it by just doing 1 or 2 time breathing and breathe out exercises. Okay, the muscles of the diaphragm contracts, the muscles of the diaphragm relaxes. Okay, understand? We can move to the next phase. Next slide. Okay, yes. I have made some MCQs for you also, but I want you to understand what's actually happening at the alveoli. I think I have told you, okay? we have actually learned what happened to the I can explain it one more time or while we will do the labeling. I have made a labeling for diagram for you, so you can do a labeling. Maybe it's not here. Or nasal cavity. From here we have pharynx or throat, and then comes here larynx, okay, or voice box. Then comes the trachea or windpipe, okay. Then here is the bronchi, and then bronchi is divided into the here bronchioles, okay. And then we have tiny air sacs. These are called bronchioles. He has actually made, this is the lungs, okay. Here we have lungs, here we have bronchioles, and here the grape-like structure is alveoli, okay. Alveoli, diaphragm, okay. Here they have given the names, okay. You can choose from here. This is the diaphragm, yeah, right. And now I have also made a quiz for you. Do together. What is the main function of respiratory system? To break down food and absorb nutrients, to pump blood throughout the body, to take in oxygen and remove carbon dioxide from the body, to support the body and protect organs. What is the right answer?